Today we will examine the nature of surgery in ancient Egypt, and we will discover thrilling and even strange insight on this topic. As early as 3300, the ancient Egyptians were engaged in medical practice. They began quite modestly, caring for topical illnesses such as scorpion stings, snake bites, and battle wounds. However, as this body of knowledge grew, it eventually positioned them, at least in terms of medicine, ahead of other civilizations in the same era. However, the average life expectancy in ancient times was still only about 34 years, which should be rather evident given all of the medical expertise at the time. In ancient Egypt, invasive surgery was simply not practiced. It was practically impossible due to the lack of anesthesia and antiseptic, which would have caused terrible pain and virtually certainly infection-related death. But topical treatments were something the ancient Egyptians were very skilled at. They were functionally knowledgeable about how to treat dislocations and set broken bones using linens and wooden splints. They were also skilled at creating herbal ointments that effectively treated burns and suturing wounds. Even these basic treatments could have meant the difference between life and death in the ancient world, even if they might seem more like first aid to modern people. And because of archaeologists, we are aware that some of the earliest very useful surgical instruments that supported medical care were among those inventions. The ancient Egyptians had tools including pincers, forceps, spoons, saws, hooks, and knives that are still used in medical institutions today, mostly made from the recently discovered metal copper. Additionally, they made superb bandages and were far ahead of their time in treating inflammation by infusing them with willow leaves. The world's first prosthetics were probably utilized in ancient Egypt, along with many other medical firsts. How are we aware? A female mummy was found close to Luxor, Egypt, and she died sometime between 950 and 710 BCE. It was discovered that it would have been quite challenging to walk in the popular footwear of the era, ancient Egyptian sandals, without a big toe. Although the exact origins of the practice are unknown, some have theorized that male circumcision may have been originated by the ancient Egyptians. Herodotus, a Greek historian who lived in the middle of the 5th century BCE, claimed that the Egyptians were the only people in the world who practiced circumcision, or at least those who had learnt it from them. The first woman to receive an MD degree in the United States was Elizabeth Blackwell, a British woman, in 1849. It should not be surprising that the first known instance of a female doctor took place in ancient Egypt. Merit Par was the first female doctor ever known to exist. Additionally, archaeologists estimate that she lived around 2700 BCE. She most likely possessed the position of chief physician, which gave her the power to instruct, supervise other medical professionals, and provide direct care for the then monarch. Even though invasive surgery was practically unheard of in ancient Egypt, their physicians were nonetheless able to gain a good understanding of the internal organs and their functions. The ideas of the time on the operation of essential organs are depicted in the Ebers Papyrus, one of the earliest known manuscripts pertaining to medical practices. Naturally, since it's difficult to overlook, they were aware of the anus and had many opinions about it, such as the idea that the air and liquid that emerges from there originates from the vessels in the arms and legs when they are bursting at the seams with waste. Almost no one liked visiting the dentist, but picture having to do it in a time when dental care wasn't very effective. When the ancient Egyptians experienced dental issues, they had to deal with precisely that. To begin with, the typical ancient Egyptian's diet was not very favorable for having a large set of teeth. Because sand and stone are inherently abrasive, the equipment used to grind food frequently left behind traces of them, which frequently resulted in early tooth loss. Although the ancient Egyptians had some strange and usually unpleasant treatments for these types of oral conditions, they did have some. The Ebers Papyrus, for instance, states that applying a powdered mixture of onion, cumin, and incense to a tooth was the remedy for toothaches. In certain instances, the ancient Egyptians carved cavities into jawbones to drain fluid abscesses and filled them with a mixture of glue and a greenish mineral that included copper. Curiously, however, tooth extraction, which can save a life in an infection, was hardly ever performed. Even though the ancient Egyptians employed a number of valid medical treatments, magic remained a major part of their primary care regimen. They thought that all illnesses had divine causes, you see. Nevertheless, they believed that healing also rationally depended on the supernatural. Therefore, a spell that was thought to promote healing was frequently included with medical treatment. A treatment for whooping cough would be one instance of this. A ground, roasted mouse would be added to milk as a medicinal remedy, and a lullaby that warded off bad spirits would be used as a magical assistance. Please like and subscribe for more content.